Welcome, everyone, and thank you for being here today. My name is Jenny Bankston, Affiliate Business Partner Manager at NACCHO. Today's webinar is hosted by Biosystems, one of NACCHO's Gold Affiliate Business Partners. Biosystems is a global digital health organization that supports public health agencies with data integration, surveillance systems, and scalable health information solutions. Their work spans partnerships with organizations including the CDC, PEPFAR, and ministries of health around the world. Before we begin, just a few quick housekeeping notes. Today's session is being recorded. The recording and slides will be shared with all registrants post-webinar. Please use the Q&A feature throughout the session to submit questions for our speakers. We'll address as many as possible during the discussion portion at the end of the presentation. Now it is my pleasure to introduce today's speakers from Biosystems. First, we have Megan Kill, Senior Manager at Biosystems, where she supports infectious disease surveillance initiatives and helps organizations implement scalable, low-cost digital health systems. We're also joined by Katherine Liu, Chief Data Officer at Biosystems, who leads data and technology strategies focused on modernizing public health systems and improving data-driven decision-making. Thank you both for joining today. Now I'll turn it over to Biosystems team to begin the presentation.
Thank you, Jenny. Now we can dive into the core topic of today's presentation, modernizing infectious disease surveillance on a budget by building low-cost, open-source, scalable surveillance systems using DHIS2. Here's a quick look at the agenda for today's presentation. We'll start by examining the current public health surveillance landscape and the core operational and economic challenges that public health departments are facing. We will also outline the core design principles necessary for a long-term, sustainable, and scalable surveillance system. Then we'll introduce DHIS2 as a platform that can resolve a lot of the challenges public health departments are facing, covering its role as a global standard, its core capabilities, and its API-first architecture. Following that, we'll provide a live demonstration of DHIS2 in action, which will be led by Megan. And then lastly, we'll discuss the economic advantages and cost considerations of using this open source platform for sustainability. Let's begin by looking at the current public health landscape for surveillance. Post-COVID-19, surveillance has shifted from a specialized technical function to a cornerstone of national security and economic stability. The pandemic exposed that fragmented, slow-moving data systems can lead to trillions in economic losses and millions of preventable deaths. As we navigate the current public health landscape, we face a perfect storm of economic and operational hurdles. First, the pandemic funding cliff is a reality. Many of the systems stood up during the COVID-19 pandemic rely on emergency grants that are now expiring. Maintaining these proprietary platforms with our high per-user licensing fees is becoming a massive financial burden that baseline budgets simply cannot sustain. Second, public health departments struggle with limited IT capacity. Departments have fallen into a cycle of building one-off, highly specialized systems for every new threat. This strains technical teams who end up spending more of their time on basic maintenance rather than strategic innovation. It's much more cost-effective to use a platform that is ready to be customized than to build from scratch every time. This leads us to the most critical operational challenge, which is system fragmentation. When data are trapped in silos, whether it's emergency department data in one place, lab results in another, and environmental or other monitoring data in a third, public health departments lose the big picture. For epidemiologists, this means that their highly specialized skill sets are wasted on manual data cleaning and reconciliation rather than actual data analysis and decision-making. Ultimately, this fragmentation compromises the detection to response time. In a 717 framework, every minute spent navigating a fragmented system is a minute lost in notification and response. Before we move on, we'd like to hear from the audience on your experience with these challenges. So first up is our first poll question. Okay, so I see your guys' responses are in, and many of you guys have talked about uncertain funding landscape, increased integrated surveillance demands, fragmented systems, slower reporting pipelines, and limited IT capacity. Uh, so given this, what we want to talk about is how can public health departments meet the growing surveillance needs in this current economic climate? To move forward, we need to transition away from these expensive, isolated tools and toward an integrated open source architecture that prioritizes data quality and real-time action. Let's move on from landscape to the solution. The success of modern surveillance relies on a few core design principles that prioritize long-term sustainability and scalability. First, we advocate for a start small, scale fast approach. You don't need a massive statewide rollout on day one. By starting with quickly building a prototype for a single disease module like syphilis or local wastewater pilot, in doing so, you can prove the value of the platform, refine your workflows, and then rapidly expand as funding or needs grow. This is made possible by a modular architecture. Unlike older monolithic systems where everything is hardwired together, we need to design surveillance modules to be managed independently. This ensures that a change in your respiratory surveillance protocols won't accidentally break your STI tracking. Using common standards and building APIs that allow for easy data flows will enable data interoperability and integration from the beginning. To ensure performance, decoupled layers should be used. This means separating the capture layer, where data are entered, from the analytics layer. If systems are decoupled layers, they can remain lightning fast for field workers even when headquarters is running massive complex reports. Finally, security needs to be built into the design through role-based access. In public health, data privacy is paramount. Granular sharing settings are essential to ensure that investigators only see the specific cases they are assigned to, while leadership sees the high-level trends they need to make decisions. This creates a secure, need-to-know environment that protects patient privacy while enabling collective action. Now I'm going to turn it over to Megan to dive into DJs too.
All right. Thanks, Katherine. Yes, so obviously we've heard about the challenges and everything, and kind of what solutions we need to overcome these challenges. So we're going to dive into DHIS too, because it really is a great solution for the current public health landscape. Before we do that, though, we have two other poll questions for you. So the first one, have you heard of DHIS 2? And the second one, have you ever used DHIS 2? I'm very curious to know if anyone has even heard of it or if you've used it. As you'll see soon, we see it more so in the global context, but yeah, interested to see its kind of scale in the US. So, all right, this is what I was thinking. Most people have never heard of DHIS 2, and then that means also most people have never used it. So yeah, thanks for responding. So we're kind of extra excited to introduce you guys to it since you guys have never really heard of it. So when we talk about DHIS 2, we aren't talking about this new kind of untested startup tool. We're really talking about a platform that has been hardened over 20 years in the most challenging environments globally. So it is the world's largest health information management system, and it's used at a national level in 76 countries at the moment for routine health reporting. And it also serves as a national surveillance system in 55 countries. So it is very large scale. And I think it's quite an amazing fact that 3.2 billion people live in countries where DHIS 2 is used as the national health reporting system. It was also used a lot globally during the COVID pandemic. So countries were deploying COVID surveillance systems on DHIS 2 within months of the start of the pandemic. And it's increasingly being used for integrated disease surveillance. It's used by the US Department of Defense for global wastewater surveillance, and also for the largest HIV monitoring system for the US State Department on PEPFAR. It's recognized as a global public good by the United Nations, as it is open sourced and free from licensing fees. It also has an extensive user community that continues to foster platform innovation, and it's backed by the CDC, WHO, and Gates Foundation, among other large donors, because it really is built to be a permanent piece of the government's health infrastructure. So what are DHIS2's core capabilities? Just to kind of cover them really quickly, DHIS2 is a fully customizable and extensible open source platform for data collection, management, analysis, and sharing of data. So it's a comprehensive platform designed to manage really the entire data lifecycle for public health, from that kind of flexible data collection, including capturing data on web and mobile tools, to robust data management and advanced visualization capabilities. So crucially, it is built with interoperability and security at its core, enabling seamless data exchange with external systems and ensuring patient privacy through configurable user roles and permissions. So that's it in general, but I want to take a little bit of a deeper dive into these core areas now, starting with how DHIS2 handles multiple data models. So when we talk about data capture, we're not just talking about a digital version of a paper form. So we're talking about a sophisticated architecture that actually matches the data model to the public health need. So DHIS2 uses three primary models. Aggregate, which is for kind of routine trends. Maybe, for example, you're capturing weekly influenza cases. Or the second model is cross-sectional, and that's really for a single point in time for like incident reports. This could be an example here is kind of like confirmed measles cases. And longitudinal tracking or case management. A lot of people refer to it as case management, where you're following a specific patient's journey. And this could be, an example here would be tuberculosis case management. So this versatility is really critical. It means that you can manage your routine reporting and your complex disease case investigations in the exact same system. To support timely and accurate surveillance, the platform provides multiple ways for data to enter the system, depending on the operational context and where the data are being generated. So one of the key strengths of the platform really is its real-time data validation, which helps improve data quality by identifying issues at the point of entry rather than later during analysis. So for routine use, staff can enter data directly through a web-based interface. But we know not everyone's always sitting behind a desk. So for field-based workflows, there is a native Android app that supports fully offline data collection. And this is this really allows users to continue working in low connectivity environments with data automatically syncing to the server once a connection is restored. The platform does also support bulk file uploads and automated integrations with external systems through APIs, which we'll talk about soon. And so this helps to reduce manual data entry and streamline data flows across systems. So DHIS2 isn't just a place to store your data. It's a platform that's designed to make the data work for you, right? The core philosophy here is this kind of data for action, right? So it has a really powerful capabilities with analytics. So the data visualizer is really where most users spend their time. It allows you to transform raw numbers into meaningful visuals. One of the most powerful features really is the indicator engine. So it lets you define standardized formulas, like say MMR vaccine coverage, so that everyone in the country is looking at the same calculation, regardless of who's generating the report. You can switch between a chart and pivot table with a single click, making it really flexible for different types of reporting needs. Aside from that, of course, we all know geography is a critical dimension of health data, especially surveillance. So the system has a Maps app, and it allows you to instantly see where cases have been reporting. Of course, the geospatial context is really vital for things like resource allocation and responding to outbreaks. The Maps app is also integrated with Google Earth Engine, and that allows users to automatically visualize and analyze the environmental and geospatial data alongside their DHIS2 data. So that's things like population density, temperature, air quality, all of these things automatically exist in DHIS2 already. So once you get your data in there, you're able to view them side by side. DHIS2 also has a really robust dashboarding feature. So it's the landing page. Of course, a lot of decision makers really love the dashboards. They provide a high-level overview of key programs. Say if a state epidemiologist sees a red flag on the dashboard, they can use a filter to drill down to a specific county or site where the issue is. And the dashboards can also be shared with specific users or user groups in the system, and that really makes it easy to kind of report on programmatic data. So the final piece of DHIS2's analytic framework is ensuring that data doesn't just sit in a dashboard, it proactively reaches the people who need it. In order to do this, there are notifications built into the system. So notifications can alert, say, epidemiologists via SMS or email when there's a set threshold that's reached. For example, expected measles cases within a geographic area to provide that kind of early warning of an outbreak. And all of that is totally configurable through the system. So how does DHIS2 continue to meet the needs of public health departments in an always changing technology landscape? The key to this really is its API first architecture. So a common fear, I think, with anyone getting any new software is getting locked in, right? DHIS2 does solve this problem because you can do everything in the user interface, and it can be done also through the robust REST API. So this philosophy does make DHIS2 more of a building block within a modern digital ecosystem and not a closed silo. And this makes it inherently compatible with almost any modern system used by state and local governments. The architecture prioritizes seamless interoperability. So DHIS2 supports global standards like HL7 and FHIR for data exchange with EMRs and lab systems. And some of you may have an enterprise data strategy already, and DHIS2 can push health data directly into, say, if you have a data warehouse, and then you can analyze those data alongside your other external data sets and additional data that you may be capturing. So finally, for advanced analytics, the platform directly integrates with industry standard BI tools like Power BI, Tableau, ArcGIS. This really helps your leadership too, and they can use whatever preferred tool if they don't want to do all of the analysis within DHIS2. So I also want to touch on the DHIS2 mapping capabilities, and I'll go through some of them in the demo as well and show you. But just to say that if you want to do more complex mapping with your data in DHIS2, there's an integration directly with ArcGIS, and that's through an already built data pipeline that connects the two software. So easy if you are capturing your data in DHIS2, you can easily view it through ArcGIS, because I think the capture function in ArcGIS is certainly not as robust as the DHIS2 one is. So now we're talking about all the features of it. How do you actually get a DHIS2 instance? DHIS2 can be hosted on a server in the cloud or on premise if required. While it can be self-hosted, not all counties or states actually have the resources to manage the system infrastructure themselves. So they may choose to do something like have a managed platform as a service or PaaS model that generally fits best with most organizations. It then allows the health department to actually just focus on public health programs, while then a certified partner handles the kind of 24/7 monitoring, backups, and security patches. And Security and compliance are critical considerations for public health systems, especially when handling sensitive health information. So DHIS2's architecture is actually designed with this in mind. DHIS2 core and its hosting partners support business associate agreements, or BAAs, which help ensure protected health information and personally identifiable information are handled securely and in alignment with HIPAA requirements. So for organizations with stricter security mandates, the system could also be deployed using FedRAMP certified cloud providers, including AWS GovCloud, Azure Government, and Google Public Sector. So this provides an additional layer of assurance around security, infrastructure standards, and regulatory compliance for state and local public health agencies. All right, are we ready to see what DHIS2 actually looks like? Well, before we dive into the demo, I'll have to unshare my screen and share the correct window, but I want to give you guys a quick overview of what I'm going to be covering. So we are going to first walk through configuration of DHIS2. We are going to actually create a simple cross-sectional survey for measles surveillance. So, and this demo is not going to take that long, maybe about 10 minutes. And in that time, you're going to see how to configure a program or a cross-sectional survey and actually capture data on it. And we'll look at all the analytics. But yes, so after we configure the cross-sectional survey, we'll move into data entry and demonstrate how a measles case can be entered into that newly created form. And then we'll explore several of DHIS2's data visualization capabilities. So we're going to look at the dashboards and interact with some charts and line lists, and then demonstrate how visualizations can be customized and annotated with interpretations and things like that to support your analysis and decision making. And then finally, I'm going to show you the Maps app, so spatial analysis using the Maps app, including kind of drilling into the underlying data directly from the Maps layer and exploring some geographic patterns in the data. So I will stop sharing this screen. Bear with for just a minute. And I will share my other screen. Okay. Here we go. All right. Here we go. So I hope you guys can all see my screen now. I'm just going to move these controls onto my other screen. All right. Okay, always takes a minute to get set up and ready. Okay, so let's go into configuring an event form or a survey in DHIS2. So I'm gonna zoom in one, there we go. Okay, I'm just gonna go into the maintenance app. I'm not gonna describe everything that I'm doing in detail, but I will, I will just kind of annotate some of the things. So this is where I'm building any kind of metadata or any forms and information that I need to capture on different programs. So I'm going to go in and create data element. And I'm going to create a measles data element. So this is to capture information on a case of measles. Let's go down here. This is the final. And the form name. And the measles outcome options that I want available to select. Okay, success, yay. And then I'm going to go in and create a program. So I'm going to call this program measles surveillance. as you can see, there's a lot of other options that I could configure, but I'm just going to do something super simple so I can show you guys how to do that. So I've already created a few other elements that I can add to it, but as you can see, the one that I just created, measles outcome, is here in the list. So I'm going to assign all of those over into the program. I could do additional things as well if I wanted to configure things for the mobile rendering type or desktop rendering type, add things as compulsory, etc. But I will go in to create the data entry form. I'm going to add a quick section here. And this is where I can then order all of the elements that I want in my form. So let's say we'll go age, sex, vaccination status, and there we go. And I can move these around too if I didn't get them right. Then in Access, I'm just going to go ahead and select the first site there. I have to save the program, and then I have to do one more thing. Back in there, Access, and then I can provide access to enter data. So I'm now saying that anyone in the system can enter data for the program. Let's see. There we go. Okay. Okay, now I'm saving it. So that was creating a program. You can see how simple it is. Of course, there's additional things that you could add to it and make it more complex, but a simple form is pretty easy to do. I'm going to go in here to the Capture app. This is where you can capture data on that program. So I will go in and find the measles surveillance program that we just created and go in and assign it to, or select the location that I assigned it to. And then I'm going to add data. So you can see here, these were the different pieces of information that I assigned to the program. So I can go in and capture the information. So we'll say we're reporting it today. I will pretend I'm 27. I have had more than 2 doses of my measles vaccination. Maybe it's more suspected. I recovered. And then I'll complete the event and save. There we go. So that's how simple it really is to create something like a quick form in DHIS2 and enter data. So you saw from the whole process of capturing or creating the metadata, so the elements within the form, the actual form, and capturing data. And that all happened in, what, 4 minutes? So aside from entering data, I'm going to go back on to the dashboard here, and let's look at some things from the visualization pieces. So in the dashboards here, I think this is a really nice addition. You can have a text box. You can put this anywhere you want. You can add and totally customize all of these elements in the dashboard, but this is just a nice one that we've created from lab and wastewater surveillance data. You can do things like, say you want to organize the data in the visualizations. I can interact with them directly here, so I can organize them. If I wanted to, categorize them in that way. Let's see, I could do things like turn off these categories in a
Hey,
bar
Megan.
chart. Yeah.
My screen is showing black right now, and it looks like someone else just reported that as well. I'm not sure why. What happened to the sharing? Maybe unshare and reshare again. Bear with us, everyone.
You saw the
It was just black.
when I created a data element.
Just in the last like 30 seconds before I interrupted you, your screen
Oh,
was black for some reason. So maybe just reshare and see if that.
Yeah, let's try that.
Yep, it's back now, so we're good.
Okay, good. Thank you. Um, okay, so you probably didn't get to see this, but as I was saying, all of these things are really totally customizable in this dashboard. I can move things around. Yeah, I can reorder it. If I went into edit here, I can change everything around in here, change the text and whatnot. Then I was showing this where I can order things. If I wanted to order, let's say, the data by the date the PCR target was assayed, I can. I
Oh,
can put
that seems to be the weird button that's making everything go black. That's weird.
strange. All right.
Yeah.
Well,
The system is not actually crashing. I'm not sure why it's crashing the Zoom, but I can guarantee that Megan can still
weird.
see your screen.
That's very strange. All right, well, I'm going to do this. There we go. Maybe if I share the whole screen, it won't have a problem. Um, I won't do the ordering
Yeah.
thing, crashes it, but
It does work though.
and I wonder if I change some of these categories, if it changes it. But the point is that you're easily able to interact with your data in the dashboards. So another thing that I really like about this is being able to interact with other users in the system on these visualizations. So if I go in and say, show details and interpretations, I can actually go in and write an interpretation about this visualization and tag someone in it. Let's see, I've got something I want to put in here. I won't spend time typing it, but say I wanted to tag myself. Um, I could tag me in this, and then I would get a notification that there was a post. And then I could easily able just to go to that visualization to see what the individual was talking about. I think this is really nice because a lot of the times we see people pulling data out of systems like this and emailing them, and then it's hard to kind of keep the thread going, and then you can't tag anyone else and things. So this really brings all the conversations about the data into one place, which is awesome. And of course, you can tag people and continue the conversation in the platform. So the other thing that I wanted to do was, let's say I wanted to go and explore this visualization in more detail. So I could open this in the line listing app, which is the app that it was created in. I can, let's see, what if I wanted to add another dimension? I could find, let's see, the concentration method. Yep, I want to add this. And I could say move it around. I can change that and update it. So now we can see the concentration method again, really quickly is you're able to modify these visualizations and see it. So that was what I wanted to show on the kind of visualization side before I switch to maps. I have another dashboard that I think is really nice with the map. So I wanted to show you guys this one too. This is a COVID-19 dashboard. Actually, these data were taken from the beginning of the pandemic, which may be give all of us really PTSD from that time. But this is the original data coming from China for the start of the pandemic. So the maps can be embedded in dashboards. You can kind of zoom in and hover over things to get more information. I could also go in and open this in the Maps app, and I can interact with it further. Let's zoom in a little bit here. You see as I zoom in, the clusters kind of break down, and you can see exactly where the points are in the map. There's a lot of different options to customize your visualizations. So I could do things like decrease the opacity here, and then I can see the underlying like cities and whatnot. I also can look at the underlying data table, which is really nice. So I can click here and I can actually see all the data that's being displayed within the map. You can do other things like if I'm searching, right, I can search down to the location. So many features. And since DHIS2 is continuously being modified and new updates and things come out all the time. They really do enhance these visualization tools very regularly. So, okay, that was everything that I really wanted to show in the demo. So thanks for bearing with me. A few little hiccups on the stopping of the screen sharing, but we got there in the end. Now let me pull the presentation back up and get my screen shared again. Okay. There we go. You can see this presentation now, Katherine? Okay.
Perfect. Thanks, Megan. So thanks for the demo. Really, we just wanted to be able to, showcase a little bit about the system because obviously, that those become important decision-making factors, actually being able to understand what the capabilities are. For this next session or this next part of the session, we just have a couple of slides and want to discuss some of the main challenges that we're facing within our systems, specifically thinking about the cost efficiency of using DHIS2. So before we talk more in depth about the economic advantages, we want to briefly address any hesitations that you guys might have. We often find that open source solutions come with certain and common concerns. So we're going to take a moment to hear from you. So what concerns, if any, do you have with using an open source platform? So this is just sort of a short answer, and it'll be really useful to hear what your guys' thoughts are on this. I feel like we need some Jeopardy music going on right now, playing in my head.
Give everyone a few minutes to write in the answers.
Yeah, thanks, Janae. We know that sometimes it's good to have some time to put some thought into it. Oh, Janae, I just realized we can see that a bunch of people have answered, but we can't actually see all of the short answers that people provided. Okay. Um, with that being said, I think that what we can do is, there's a number of concerns that we have certainly heard around open source solutions. Um, and I think that we want to talk a little bit about sort of the buy versus build versus the sort of other third variable, which is open source. So we often find that a lot of core hesitations around open source often have to do with things like sustainability, whether or not the platform is going to be maintained by sort of the open source provider for long periods of time. Other concerns that we often hear are around the specialization of open source software and whether you're able to get absolutely everything that you need out of an information system or a platform if it's open source. I would say that those are probably the two most, and then security is potentially a third. And those are at least the three major ones that we tend to hear a lot from our partners. So what we wanted to do was to even think about first a classic buy versus build dilemma. When we discuss technical architecture of DHIS2, we're really talking about this solving a very common challenge that every IT director faces when they're thinking about what kind of technology or digital solution they want to use and implement. Oftentimes, if you buy a proprietary system, or also known as commercial off the shelf, you're often stuck in a silo where every new feature request costs a change order. So we've heard oftentimes from our partners, well, we wanted to add that new feature, and once we added the new data stream or wanted to add a new disease to our existing information system, it was $10,000 or $15,000 in order to create that change. Every time that you want a different report generated, oftentimes there's a surcharge with that as well. That being said, if you build something entirely yourself where you are getting every feature that you want, but require sort of that custom development and IT expertise and developer expertise, you're then responsible for every line of code, every security patch, every API update for the next decade or however long you're going to be using your proprietary or custom solution. So what we've talked about in DHIS2, and one of the advantages that we think of a solution like DHIS2, where it's sort of a core platform, but it can be configured to meet your needs. We think that DHIS2 really offers a middle path because of its API first architecture, as well as its modular app framework. So you have the build flexibility to tailor it to your state or county specific epidemiological needs or national reporting mandates without starting from zero. I'm sure that you guys are all familiar with the 80/20 rule. Oftentimes, I think that that can apply to almost every wake of my life, at least. And so we often say the same thing with DHIS2, that DHIS2 out of the box will often meet 80% of the needs that any organization has. And the 20% of it is really thinking about, at that point, can you then extend the features and the functionality of DHIS2 to further meet the needs, or do you actually need all 20% of those requirements? So that is sort of where we find ourselves with DHIS2, and that's a lesson that we've learned from a lot of the partners that have implemented DHIS2. Talking a little bit more about the economic advantages of using DHIS2, traditional proprietary systems create what we sort of call a success tax, which means that the more successful and the more users you add to your system, the more your licensing fees tend to increase and skyrocket. Because of the way that DHIS2 is configured, or because it's open source and there aren't any licensing cost, you avoid a lot of this success tax. You have total freedom to grant access to every county clerk or field epidemiologist or every data collector without checking for your budget first. And so it really allows for that scalability component. The real return on investment, however, comes from how the system is managed and maintained over time. Because DHIS2 is a no-code platform, configuration can be done by public health and informatics professionals. So many of you guys that are actually on this call can then be used and can have the skills necessary to change your data collection forms, add new programs as needed. And you don't just need software engineers or your IT teams to do all of this. This significantly reduces the technical barriers to entry for system administrators. Simple changes like updating workflows, modifying a data element, or adjusting a report can be done internally within teams and within technical teams, or subject matter expert teams, I should say, without relying on an external vendor or a software development or IT team. This not only reduces vendor dependency, but also allows you guys as health departments to respond much more quickly to changing public health needs. It also means that smaller, more specialized teams can effectively maintain and manage the system compared to many of the proprietary or heavily custom-built platforms. Lastly, you don't need to start from a blank slate. There are a number of metadata packages that have been sort of customized and used heavily, influenced by the WHO or the World Health Organization and sort of their best practices around disease data capture, management, analysis. And this allows for you guys as implementers to bypass the lengthy decision or the design work phases. The packages are built on global best practices and then can be adapted to meet CDC or HHS reporting requirements almost instantaneously. So in a demo environment, you can literally upload a package and start collecting standardized data within a day. And this level of agility is something that a custom system just cannot match. Now that we've covered the immediate economic advantages, we also want to look at the final piece of the sustainability puzzle, which is really the robust ecosystem of support and continuous evolution that protects your long-term investment. One of the biggest hidden costs of software is training and maintenance. With custom or proprietary software, you often have to pay for expensive premium support or custom training manuals or one-on-one time from the vendor that developed the platform. DHIS2 really turns this model on its head. There's a massive global community of support that's freely available. So thousands and thousands or tens of thousands of users go to the DHIS2 community of practice. And anytime your team hits a technical snag, the answer is likely already on the community of practice forum with a response on how to overcome or address the issue. Additionally, the University of Oslo, who are the core developers of the software, provides free self-paced academies that allow for staff to go from a novice to a power user without a single tuition dollar being spent. And so it's great, the number of courses that they have and sort of like course sort of predictions of if you want to be a specialty in the analytics, there's a number of courses just on analytics that you can take as a user. And this really allows for making it cheaper, more sustainable ecosystem for organizations to start using and keep using DHIS2. Finally, we can talk about the system of life. So custom-built software starts and dies the moment that developers stop writing the code. It becomes a legacy system very quickly. Oftentimes, solutions have a shelf life of about 5 years before it really needs a major overhaul. DHIS2, however, is a living platform that has continuously evolved over the last 20 years. Bug fixes and security patches are pushed out regularly, and new core features are pushed out on an annual basis. The DHIS2 community also has a voting feature, so you can actually vote for new features to be added to the core platform that the developers will look at. And so oftentimes, if you are demanding for a new feature, you're not going to be the only one that's demanding that feature. And those solutions are then pushed out within the application so that the entire user base of the platform can take advantage of that. So a few key takeaways that we really want you to gain from this session. Really, we want to shift your focus from DHIS2 as a product to DHIS2 as a strategic solution for long-term health system sustainability. And the central question that we are asking you guys are as representatives of your county and state health departments is your current system meeting the moment? Is it meeting the needs that you guys have? Is it able to evolve as you need it to? And are you able to collect the data that you need to collect and make the decisions that you need to be able to make in order to do your jobs in the time frame in which you need to make those decisions to really have impact? So let's quickly look through the obstacles we've discussed. First, data silos. If your different programs like influenza or STI surveillance are trapped in separate systems, are you wasting the specialized skill sets of your epidemiologists or manual data reconciliation? DHIS2 solves this problem by collecting different types of data. So whether it's aggregate, cross-sectional, or longitudinal data models into a single repository, as well as ability to scale and add new programs as needed. Next, thinking about timeliness. If you're waiting weeks for manual aggregation and reporting, you can't achieve real-time detection and to response. Because DHIS2 supports flexible data capture from native Android apps to automated API feeds, it delivers the real-time data that you need and displays the data in a way that you can ingest and make decisions on it. Flexibility is non-negotiable. When a new threat emerges, can you add a new data collection form and dashboard within hours? Or does it require a 6-month contract with a software vendor to make those changes? Because DHIS2 does not involve any code for configuration, and because of its modular design, DHIS2 really does empower public health departments and staff to adapt immediately without needing specialized skill sets. To directly address the buy versus build dilemma, you don't have to choose between the security of a product and the customization of a custom build. You get both the best of both worlds in a battle-tested core engine with open source freedom to build, ensuring that you're never locked into a single vendor. Finally, the ability to scale without adding huge additional costs for user licenses. With zero licensing fees, you have total freedom to scale to every clinic, every user, every county, every state, really, without your budget skyrocketing. So really, if your goal is to reduce per user costs, empower your staff to drive public health action, and not just manage software permissions, then we really, think that DHIS2 is something that is worthy of consideration. So lastly, we just want to thank everybody for your time and for your attention. And certainly we would love to take questions that you guys have. If anything, after this, you guys have questions, you are free to reach out to us, BAO Systems. We are an implementer of DHIS2. We are not the core developers of DHIS2. We're happy to answer any questions that you guys may have. You're also free to reach out to the University of Oslo and their DHIS2 program. We've put in the websites for contact up here. You are free to reach out to them with questions as well if you just want to learn even more information. Sorry, we're happy to take questions. And I see one question in the chat, which is, can you upload an Excel sheet into the system, or do you have to input them line by line? You can bulk load in CSV or Excel format. I think there's a number of other formats that are supported, but bulk data upload certainly is one of them, and it's certainly something that is used frequently. Any other questions? We're monitoring both the chats as well as the Q&A feature in Zoom.
I think it might be interesting, actually, if we could. Obviously, we've been talking this whole time about surveillance systems. Well, not everyone is using DHIS2 for surveillance. So maybe, Katherine, you could touch on some of the additional use cases where we see DHIS2 being used.
Yeah, thanks. So I know that Megan had mentioned early on that we are doing wastewater surveillance. We're also doing HIV, TB, malaria. Outside of surveillance, specifically, we have supported partners to implement DHIS2 in maternal child health, immunizations, neglected tropical diseases, which thankfully is less of a problem here in the United States. We have seen that around malaria control programs. We have also seen it in the education sector and community-based provider sector. So a lot of antenatal care programs are done in DHIS2 where you can actually longitudinally follow the mother and the child. We have seen it in sort of vulnerable household and for sort of a household surveys. And I'm trying to think, education is one of the newer ones. We're actually are supporting and working with the University of Oslo, doing that in Nigeria. It's also being used globally for supply chain management. So thinking about, we talk about longitudinal tracking. It doesn't have to be a person, it can be a thing. So thinking about tracking drug supplies, tracking vaccines, all of that has been done in DHIS2 as well. I think one of the benefits is that while it was intended for health at its beginning and in its inception, the use cases have really broadened up. We've seen it in agriculture and nutrition projects as well. So really, any kind of data that you want to collect or are already collecting, it's likely that it could be collected in DHIS2.
Yeah.
Yeah,
We've
I
got
saw. just wanted to see one of the questions that have come in here. One of the primary use cases is following about exposed contacts and tracking tasks like calls, follow-ups, reminders, et cetera. So 100% this has been used for case investigation. We have seen this actually in the TB use case. So you have an initial identified case, and then you want to do contact tracing of all sort of, whether it's a TB case or another infectious disease case, we have used that for contact tracing. Within the system, you're able to collect personal identifying information such as phone numbers, and you are also able to relate and establish relationships between the initial primary index case as well as the other contacts.
Yep, and actually they did a lot of case investigation or contact tracing for COVID when it came out. So there are some standard tools that you can actually just implement really quickly. Like Katherine was mentioning, the WHO packages that you can put on your DHIS2 instance. So they have standard things like that already. Yep, and you can kind of track and send out reminders to people for different appointments and things, and schedule appointments in the system too. So yes, yeah.
Yep. So I think that was one of the follow-up questions for the task management, that can be done, where you can assign individuals to follow up on those cases. In terms of local health departments, so we are not supporting currently. We are not. No, we are aware of. We are aware of. There are some community-based usage. Not. We are not currently aware of any local health departments, but there's no reason why it couldn't be used by a local health department versus a county or state. And we have seen this used. We have supported sort of the configuration. Megan, you actually supported this project that's used by community care.
Yeah, community health-based organization. So kind of following up individuals, ensuring that they're able to access healthcare and information they need, and trying to essentially yeah, get them connected to people who can provide them with services. So yeah.
Yeah, so
Not
it's
specifically the local health departments.
yeah, but it's definitely one of those things that we see as from a community-based organization all the way up to the state or national level. The DHIS2 has the capacity to sort of be flexible and meet the needs of every at any level, really. I know that we have 2 minutes left of time if there's any last questions.
And we can also put our email addresses in the chat, and you can follow up with us directly. I think maybe Jenny is going to send that around anyway. But I'll post Katherine's here. Love to have a conversation if you guys are interested. I know that none of you guys have really heard of it, so it's probably something that you're like, wait a minute, this could be useful. So if you are wanting to know a little bit more information about it, please reach out. Yeah. Okay, awesome. Well, yeah.
Thank you. And thanks, Jenny and Janae.
Yeah, thanks for
Oh,
having
it's our pleasure, and what a fabulous presentation. Before we close, I'd like to again thank everyone for joining today, and thanks to our Gold Affiliate Business Partner BOS Systems. Appreciate it. Everybody have a great afternoon.
Thanks.